Over the last 2 decades, the Holiday Crisis Hotline has always been here for people that during this time of year may need a friendly voice to talk to, or maybe just somebody that can help them through what they're going through. It's not that time of year when you want to be feeling down, but unfortunately some people do, and that's why this very worthwhile project is here. Sarah Dimla and Gail Osborne are here, and we are going to talk about this very worthwhile endeavor. Ladies, Happy New Year.
Happy New Year.
Okay.
Merry Christmas still.
Yeah, Merry belated Christmas. You can always say Merry Christmas.
Yes.
Well, unfortunately, like I said, for some people, the holidays are especially hard because everybody else is out having fun, and
Right.
there's that real festive spirit that tends to amplify how bad some people are feeling and everything. So, what's the purpose of the Holiday Crisis Hotline, and what type of services does it provide? And more importantly, what doesn't it provide? Because that's key.
Well, it provides intervention and also resources to refer people who are having issues, different kinds of issues.
And what might those be?
Depression, suicidal thoughts, loneliness,
Right.
grieving.
And in a typical year, what's the volume in terms of the number of calls that are received over the time
Over
of the
the years,
hotline is
about
open?
30. On an average, about 30
Right.
calls per year.
But I just want to point out that the Holiday Crisis Hotline, it's only between Christmas and New Year, but that's when the volunteers come out to be responders for the calls. But the Crisis Hotline is actually a year-round service through the Guam Behavioral Health and Wellness Center. So if there's anybody else who feels like they are in crisis, they need some help, they can always call this number and they can get help from that number.
Now, I was fortunate because I got to be a volunteer a few years ago.
Thank you.
And the training is most excellent. I mean, you run it through, and like I was saying, I mean, it's also important because there are volunteers and people like myself who aren't trained clinicians or
Right.
like experts in crisis management.
Who can be very much be helpful still.
Yeah, but still, they say, okay, well, you're not a licensed psychologist or anything
Right.
like that, so know that when something comes up and everything, here is who you pass them off to, and here's, okay, well, I can get somebody on the phone that can help you out, and if you need a ride or if you need somebody, if this is a really, really dire matter and everything, I can help you out.
And that's what the training involves. We teach them how to be in touch with their listening skills and then know how to intervene. And then at the very end of the call with referral, that's the basic key, that's the basic help that they can provide to the person who's in crisis. Who can they refer to so that the person who's calling can get the help that they called for?
Without getting too much into the demographics of it, is there a typical age range of the number of people that call? Is it typically older people, maybe?
It's typically young adults and older people.
Oh, okay. So I guess maybe
During the
some of the commercialism of Christmas and my friends have money and they have these big families and everything like that. I
Right.
kind of feel a little bit down. So
And and then when we look at young adults and older adults, we tend to think financial situations,
Right.
stressful times, and then you have those with loved ones that are deployed. We have calls. We have had long distance calls.
Oh, really?
Yes, we have over the years.
And what's the average length of a call? Because I know when I went through the training, like I said, they're like, some are just 20 seconds and someone just wants to hear a friendly voice just say
Right.
Happy New Year, and
Right.
that'll make all the difference in the world. Other people may want to, kind of have a nice long conversation with somebody that they can just listen to them.
On an average, it's between 10 to 15 minutes. Yeah.
Okay.
We try not to also tie up the lines
Right,
You
yeah,
know,
that's very important
for other
too.
callers.
Okay, well, what else is going on?
Well, since we're talking about volunteering and giving back to the community, we also want to invite people, especially those who are involved in nonprofit organizations, to partner up with us at the Peace Office. We do have the Partnerships for Success grant, which we're giving out information during village meetings. If they go to our website, peaceguam.org, we have village meetings set up from December through February, and what they'll know is how they can be part of the prevention initiative for our island people. So if their goal for their group is to prevent substance abuse, also prevent suicide from happening among our youth and young adults, even the adults. This is an opportunity for them to possibly receive funding and partner up with us so that they can do programs that actually work.
Okay, that's an interesting topic because funding has been an issue at least not this year, but in the previous year and maybe even the year before that, because I remember a lot of people that I know wanted to help out, but they said because of a funding shortage, you weren't able to take on volunteers, not necessarily because the volunteers get paid, because they don't, because they're volunteers,
Yes.
Right.
but because of the training that's
Resources,
that
cost
you have
money.
to apply to that. What's the situation with that right now? Are you guys back on solid ground as far as that goes?
Specifically for the Prevention and Training Branch, also called the Peace Office, we've competed for federal grants, and this is a 5-year grant that we just received this fiscal year. So we're receiving federal funding, but it's basically the federal government gives the money to Guam Behavioral Health Prevention and Training Branch, and then we in turn subgrant it to local organizations so that they can implement local prevention services using the federal money.
Okay.
So it's an opportunity for them if they feel that their goals are in line with the peace goals, which is preventing substance abuse and preventing suicide among our people. This is an opportunity for them to receive some support from us so that they can in turn provide services with their target demographic.
And
Okay,
continue their efforts with the programs.
Exactly. Okay, well, we got to go to commercial, but real quick, and I guess the most obvious question is, what is the number? Because certainly there are some people watching this right now that may want to avail of it. So what's the number?
The Holiday Crisis Hotline number is 647-8833.
8833. 647-8833. Ladies, thank you so much, and Happy New Year.
And thank you. Happy New Year.
Happy New Year.
Stay tuned. We're back after this.